Hello, Senator Ted Budd. My name is Kathleen Momsen. I'm a constituent of the state of North Carolina. I reside in the northeast corner of Union County, and I would like to welcome you in your new role as state senator of our great state of North Carolina, as well as a representative for the state in the U.S. government. I am speaking to you today to gain your support for Senate Bill 4844, introduced to the Health, Education, Labor, and Pension Committee September 14th of 2022 by Senator Jeff Merkel of Oregon, the chair of the Nursing Caucus, and your fellow North Carolina State Senator Tom Tillis. Senate Bill 4844 states this is to amend the Public Health Service Act and be cited as the National Nursing Workforce Center Act of 2022 by the 17th Congressional Session. It is to support and stabilize the existing nursing workforce, establish programs to increase the number of nurses, as well as for other purposes. But I want to tell you why this is important to me. I grew up in a poor community with high unemployment, including in my own family. My neighbor was a nurse. She worked nights at the area hospital to support her family and also volunteered at the church clinic. I envisioned that for myself. I'm going to be a nurse, and I'm going to help others, and I'm going to support my family. When I applied to the nursing program, there was a long wait list of people like me that wanted to be a nurse. But there was not enough spots in the schools because there was just enough educators to teach us and support us. I did graduate, and when I received my degree, I came at my job with a full-on sprint. I was a new RN with many complex patients. I was orienting with a nurse that had been in the field for over 30 years, but she was retiring. Complex needs just did her in. The aging population that we are encountering today requires more complex care, intense medical needs, as well as bridges to medical and social needs in their community. To handle that influx of needs, a substantial increase in the distribution of the nursing workforce and their education will better prepare us for this community-based setting with this diverse population and their variety of lived experiences. There's many social determinants of health. Poverty, limited access to health care puts a great strain on the capacity of the nursing workforce. In addition to the growth of the U.S. population in mental and behavior conditions, lack of primary access and the chronic comorbidities that we see, such as Alzheimer's and dementia, increase the type of care required of the nursing staff. The growth of nurse practitioners and other advanced practice nurses, such as midwives, will benefit our society as at large. The advanced practice nurses are able to work as acute care areas as the primary provider in these at-risk communities. This is where Senate Bill 4844 solves this problem. This amendment to the Workforce Act is a grant to enhance or establish state-based nursing programs that can conduct research and a comprehensive analysis of the workforce gaps in nursing. It will also gather data related to the pay needs and the leadership development of faculty in 2- and 4-year programs, which is important to me as a future nurse educator and a member of the National League for Nursing. Bill 4844 also includes research and analysis for enrollment retention, education numbers, and the financial needs of potential students related to their recruitment and challenges, including workforce diversity, as well as why of RNs leaving the profession. The data gathered from Senate Bill 44 will improve the quality of healthcare across the U.S. The programs that choose to participate will show an increase in the nursing workforce, publish articles, develop evidence-based and best practice in their programs that will decrease the nursing shortage. Bill 4844 focuses on education and job training in underserved communities and high-risk population areas like the community I grew up in, and that is true of many areas in our home state as well. In addition to research, Bill 4844 creates support and modernizes education programs and criteria at the state nursing schools. And this helps retain current faculty as well as hiring new faculty with an emphasis on ethnic groups that are underrepresented in our current nursing force. There's also measures in place for repayment of student loans for RNs and for advanced practice nurses that are willing to work in the shortage of primary and mental health facilities, as well as maternal prenatal care. There is also going to be a portion of Bill 4844 that is used to hire school nurses in the Indian Health Service program to increase health care for this at-risk population. I would like to thank you for listening to my presentation on Bill 4844. When it comes out of committee and it comes to the Senate floor, I want you to vote for it and make the world better.